Good afternoon. Thank you for joining us today. I'm Victoria Strang, Community Impact Director of the American Heart Association in Southern New England. We are thrilled that you have joined us for the first of our two community conversations in partnership with the Rhode Island Parent Information Network. Special thanks to our sponsor, Neighborhood Health Plan of Rhode Island, for helping us to fund this important initiative. The American Heart Association is working with researchers, medical experts, community leaders, businesses, families, and more to reduce the impact of the coronavirus. Our top priority is the health and well-being of all individuals and their families, locally and across the globe. We want to keep you informed with trusted, science-based information and provide our communities with support and resources available through the AHA. Today, we have several speakers from our community who we are going to hear from, including Mark Gray, Rosemary O'Brien, and Dr. Chester Hedgepeth. We are so grateful for the work of our community partner, the Rhode Island Parent Information Network, who is serving as our local host for this conversation. Here to say more about the critical work RIPIN is doing is Mark Gray, Communications and Community Engagement Manager.
Thank you, Victoria. Thanks to the American Heart Association and Neighborhood Health Plan of Rhode Island for inviting us to be a partner to educate the community about some very important topics. Before we begin, I just wanted to introduce RIPIN for those of you who might not be familiar with us. RIPIN is the Rhode Island Parent Information Network. We are an independent nonprofit organization, and we're made up of peer professionals. And I'll explain a little bit about what that means in just a moment. What we do, we help Rhode Islanders access, understand, navigate healthcare, special education, supports for individuals with disabilities, and more. We help folks access and navigate those complex systems. And we do it using what's called a peer professional model. So what does that mean? Peer support is sort of what sets us apart from other organizations. It means that the person who is helping you access special education, access services and supports in healthcare, that person has firsthand experience caring for a loved one with special needs. And more than 3/4 of our staff are peers. More than 3/4 of our staff have a child or a parent or someone in their lives whom they have had to support in navigating these complex systems. RIPIN takes that lived experience, we combine it with professional training, high quality training to help Rhode Islanders in a way that we otherwise wouldn't be able to. So some of the things that RIPIN can help with, and we're just gonna break these down into 3 broad categories, starting with healthcare. We can help you get health coverage if you don't have it. We can help you use your health insurance, understand it, help with things like appeals, resolve insurance issues, denials of coverage, or finding a specialist, finding a doctor who's in network. We can help you access different wellness programs that are available. We do some care management support as well, some care coordination work. And in the area of special education, we can help you sort of understand your rights as a parent and the rights as to what your child is entitled to under state and federal law. We can help you navigate complex IEP, 504 processes, making sure you get the services and accommodations you need for your child. Help you develop your own advocacy skills to be a better advocate for yourself and for your child. We do transitioning to adult services for folks who are older, for older kids as they transition to adulthood. We offer a variety of resources, workshops, trainings, lots of webinars now these days that help educate folks on these topics. And in the areas of support services for individuals with disabilities, we have early intervention programs for children age birth to age 3. We have the Rhode Island Medical Home Portal. This is a resource that has lots of different sources of information and providers for individuals with disabilities. We do care coordination services. We have a Cedar Family Center, and we have a variety of support groups for individuals and for their families. So how do you access these services? How do you get help? We have a call center. It's staffed again by peer professionals. They're going to work with you, whatever your issue is, from start to finish. And they'll connect you to any RIPIN services that can help you. And they'll help you identify and access services and supports from outside of RIPIN as well. And here's how you can reach us. You can call our call center Monday through Friday, 8 a.m. to 5 p.m. Most of the time during those hours, you will get a live answer. You can call us after hours or leave a voicemail, or you can send an email to callcenter@ripin.org. And usually a member of our team will get back to you within a couple of business days. And as I mentioned earlier, we also produce lots of workshops and webinars that are led by our peer professional staff, and you can access those and many other resources on our website, www.ripin.org. Connect with us on social media. And if you have any questions, please do not hesitate to reach out. With that, I'll say thanks, and I'll turn it back over to Victoria to introduce the experts you've come to hear from today.
Thanks so much for that, Mark, and for the amazing work that RIPIN does for our community. Today, we are joined by two local experts, cardiologist Dr. Chester Hedgepeth of Care New England and health and wellness specialist Rosemary O'Brien from Neighborhood Health Plan of Rhode Island. They will begin our conversation, but we also want to make sure that we hear from you. Throughout the speakers' presentations, we invite you to submit questions to the chat box, which we will answer at the end of the program. In addition, we are recording this webinar and will make it available to everyone after the event. And finally, if you are using social media throughout the conversation, please use the hashtags that you see on the screen, hashtag SNEHeart or @SNEHeart. Our speakers today will discuss how to manage chronic conditions during COVID-19 with specific attention on what people living with heart disease, hypertension, and diabetes can do to stay healthy and safe. Now I'd like to introduce our first speaker, Dr. Chester Hedgepeth, the Chief of Cardiology at Care New England.
Thank you, Victoria, and thanks to the American Heart Association for inviting me today. Can you forward to the next slide? And so, you know, I'm a cardiologist, and cardiology is one of the, and heart disease management in particularly is one of the top chronic diseases that we see in the United States and around the world. And, you know, I focus most of my time managing patients who have heart disease and complications from heart disease. And this has been particularly important in the era of COVID-19. So I'm especially excited to talk to you about this today. You can go to the next slide. So cardiovascular disease is really a output or synthesis of many other diseases. So you can think about diabetes, hypertension, obesity, poor diet, all kind of feeding in together to lead to worsening burden of heart disease. And we in cardiology, over the course of the last 30 years, between the 1970s and 2000s, had tremendous improvements in overall cardiovascular disease mortality, mostly based on cholesterol-lowering medications and some cardiovascular procedures like stenting and heart surgery. However, you can see when we hit this kind of nadir in 2010, things started to get worse, and they continue to trend worse, mostly related to the epidemic of diabetes and obesity, two other chronic diseases which are feeding into overall heart disease burden. Next slide, please. So in 2010, the American Heart Association really declared war on this kind of trend and put forward the following statement, that by 2020, their goal was to improve cardiovascular health of all Americans by 20% while reducing deaths from cardiovascular disease by 20%. And while we're not there quite yet, we have a very good preventative plan in place. So next slide. So the AHA's Life Simple 7 puts together 7 metrics, which when achieved can lower the overall population-based heart disease risk by certainly greater than 20%. And some people feel like these preventative measures could almost, if when achieved, could almost eliminate garden variety heart disease. And the major metrics are smoking, healthy diet, physical activity, managing body weight, blood pressure control, getting blood cholesterol under good control, and maintaining and optimizing blood sugar. And so for people who are in this kind of red orangish zone at the bottom, we want to slowly move them into the yellow and then ultimately into the green. And if we, as physicians and primary care doctors, can achieve this kind of gentle migration towards positivity, we will ultimately lower the overall burden of cardiovascular disease, one of the major chronic diseases. Next slide. So restated, if we were able to achieve all these metrics, we would have 1/10 the rate of heart attack and stroke. We would have lower rates of atherosclerosis or plaque buildup, lower rates of death from all causes, lower rates of kidney disease, Alzheimer's disease, and cancer, greater health. So this idea of living longer, but also living better, health span, and greater longevity. Next slide. So I really like this slide because I feel like it applies to everyone, and that we all have this kind of fork in the road that we sometimes approach in life, where we can make healthy choices or we can make unhealthy choices. And I think as a physician and as a caregiver for friends and family, we always want to try to be helping people move towards this healthy road. So less smoking or no smoking, improving physical activity, encouraging healthy eating, maintaining a normal body weight and blood pressure, getting sugars under control. And if we can do that thing, we can stay off of this path on the left, which is the very dangerous path which leads to heart disease and premature death. Next slide. So I want to, in these next few slides, just march through these kinds of metrics. And I think, on the surface, it all makes sense, but just to dig in a little bit more about some of the reasons why these issues are so important. So smoking certainly increases the risk for heart disease in many, many ways, by increasing vasoconstriction, which can be very dangerous for blood flow in the heart, increasing clotting risk. I think about the chemicals in cigarettes as damaging the sensitive lining in the heart, increasing inflammation, and increasing lipids, which can get deposited in the plaques around the heart. Next slide. Smoking is the #2 cause of death and disability in the United States. And I find this statistic particularly disturbing, that 1 in 2 smokers will die of a smoking-related disease, and 1/3 of those will be from cardiovascular disease. The risk of heart disease and the severity of heart disease is proportional to the number of cigarettes that you smoke per day. So it is important to continue to press people to smoke less and less. It's not a 0 or 1. If we can get people smoking 50% less or 75% less, they will ultimately do better. Next slide. Diet. And I always say to people, that when people and patients ask, what's a healthy diet? I say, well, we may not know what a healthy diet is, but we all know what's unhealthy. And that's fast food, that's a lot of processed food, that's a lot of sugary food, or those really high carb load type foods, which can get insulin and blood glucose levels way out of control. The importance of eating a heart healthy diet has been, and especially for heart disease prevention, has been reiterated 1,000 times in the literature. It's been very difficult for us to execute this on a population health basis. Next slide, please. Really, it is one of the biggest challenges for our society, as poor diet is probably the #1 contributor to US death and disability, mainly because it has contributed to this kind of epidemic of obesity and diabetes. In prospective studies, eating healthy foods, which are natural and unprocessed, things like whole grains, beans, fiber, fruits, vegetables, nuts, omega-3 fatty acids, those things tend to reduce heart disease risk. In addition, the Mediterranean diet with extra virgin olive oil and nuts has been one of the main studies which has shown cardiovascular risk reduction over time, and is supported again in many literature references. Next slide, please. Physical activity and exercise contributes to heart health in many ways. One, it helps to maintain a healthy body weight. It lowers blood triglycerides, which are the fats in the blood, decreases glucose and helps to more efficiently use blood sugars, which are circulating, decreases inflammation, lowers mental stress. And one of the things which is not on the slide, which maintaining high levels of physical activity does, is it helps us sleep better. And so many important things happen physiologically for our heart during sleep. Next slide. Inactivity, or the inability to exercise moderately, is a large contributor to death. And I think with our technology-based society, with the pandemic, with the challenges that we have right now, we're all moving less, we interact less, and this is having an effect on our overall cardiovascular risk. If we can make it to our targets of moderate exercise for 150 minutes each week, or vigorous exercise, high intensity exercise for 75 minutes each week, we can lower our overall heart attack and cardiovascular risk by 20 to 30%. Very important to encourage this for all of our patients and everyone in the United States. Next slide. Really, what I ask patients to do is to set goals for exercise. Don't set unrealistic goals like, go from not exercising at all to say you want to run a marathon. It's better to set realistic goals, time-based. So really to say, instead of I want to run a mile or 3 miles, to say I want to walk or do a light run for 30 minutes every day so I can get to my 150 minutes. Pedometers, wearables, which give us feedback about our heart rate and how many steps we're getting, have been very popular and I think useful, especially for our cardiovascular patients. And we always ask people to think about their behaviors and how they can optimize their behaviors to get more exercise. Park farther away from your work so you get more steps in, use the stairs instead of an elevator or escalator. Find a partner, your spouse, significant other, somebody at work, and start an exercise program with them and really self-monitor. Next slide, please. Body weight management. This is another major challenge, and it feeds into the 2 prior steps, which are diet and exercise. If we don't diet and we maintain a poor diet and we don't exercise, we're going to have unhealthy body weight. The more we exercise and the healthier our diet, the more our body weight is going to moderate and get into our optimized zone. If we can lose excess body weight and maintain a body mass index around 25, which is the ratio of our height to weight, we would see decreased blood pressures, decreased triglycerides, improved blood sugar control, and decreased overall inflammation. Next slide. Obesity is the third largest contributor to disability and the fourth largest contributor to death in the United States. And this is mainly because of the association with type 2 diabetes, hypertension, and then resultant cardiovascular disease. Cardiovascular risk and death are proportional to the body mass index and abdominal fat, which is this very important waist to hip ratio. So we want to try to get waist sizes down, visceral fat levels down, and that will improve overall cardiovascular risk. We know that weight loss is beneficial even if we don't reach that optimized BMI or body mass index. Even a weight loss of around 5% can have significant effects on blood pressure, glucose, and triglyceride control. Next slide. Cholesterol, critical component of plaque buildup in the heart. We want overall less LDL, which is the dangerous form of cholesterol, and more HDL, which is the very protective and beneficial form of cholesterol. Our bodies make cholesterol in the liver, but it's also absorbed from the foods that we eat in the gut. So we want to decrease the production if we can, and sometimes we need medications to do that. And we want to decrease the absorption by eating foods which are low in cholesterol. Next slide. This is overall the 7th largest contributor to the US, to deaths in the United States, and accounts for 50% of heart attack risk. Again, this was one of the areas where we had made the most inroads in control and improvement with our LDL or cholesterol lowering medications. The benefits of cholesterol lowering: each 35 to 40 point decrease in LDL, or the dangerous form of cholesterol, lowers the risk of cardiovascular events by 25%, which is a huge amount. Next slide, please. Blood pressure control is critical, and what I was taught in medical school, high blood pressure is really the silent killer. As high pressures, like pumping water through a hose at very high rates, can cause damage to the very sensitive lining of the vessels, especially in sensitive organs like the heart, in the eyes, in the kidneys. And over time, that can lead to higher heart disease risk. Next slide. When we look at in our own state of Rhode Island, we see significant increases in high blood pressure risk over the last 20 years. So you can see in 1996, the overall rate of hypertension in Rhode Island was around 23%. Now it's approaching 35%. The circular balls are Rhode Island, and the square are the national curve. So Rhode Island at least is a little bit better than the national rates, but both are unfortunately moving in the wrong direction. Next slide. We know that blood pressure is a significant cause of death and disability, and associated with almost a quarter of heart attacks and certainly most strokes. If we can get blood pressure down to target levels and monitor it closely, just buying that cuff at CVS or Walgreens and monitoring the blood pressure a couple times a month could potentially reduce your stroke risk by 30 to 40% and heart attack risk by 15 to 20%. Next slide. And finally, controlling blood sugars, critical to prevent patients from developing type 2 diabetes, which really is an epidemic in the United States. If we can control blood sugars, we will have decreased cholesterol and plaque buildup, decreased thickening of the arteries in those sensitive organs like the heart, the eyes, and the kidneys. I think about high blood sugar, like the sugar crystals coursing through the arteries and damaging the lining over time. And this injury is, when it's not controlled, can lead to significant morbidity and mortality. Next slide. So the diabetic rates in Rhode Island, in our area, have gone up significantly, just like high blood pressure over time, and are similar to the national average. Now, 1 in 10 in Rhode Island will have type 2 diabetes. Next slide. So again, just to restate, this is a significant cause of disability. It is proportional to the severity of blood sugar elevation. So the lower, even though we may have patients who are borderline or pre-diabetic, if we can encourage them with diet and exercise to get their blood sugars down, their risk of significant heart disease will be lessened. So it's not an all or nothing. For diabetic patients, their risk of heart attack is 2 times higher for men, 3 times higher for women. Very significant. Next slide, please. So we know that patients with chronic diseases, diabetes, hypertension, obesity, and heart disease are at higher risk for complications and death from COVID. And we see the initial results of many studies in the New England Journal and other publications showing this. The reasons for this are that many are their access to healthcare has been lost. There's a significant economic impact on COVID, maybe lost jobs, lost income, which affects their ability to afford their medications or see their same physicians, and then distancing, which disrupts our normal social networks and prevents our ability to check on each other and make sure that our health of our neighbors and friends and family is stable. This disproportionately affects older patients. And we know that those, oh, you can go to the next slide. We know that COVID affects patients with chronic conditions in a kind of organized way. So patients with diabetes are significantly affected. And I was trying to discern the reasons for this, which seem to be, one, during the COVID pandemic, we don't eat the same. We eat a much more unhealthy diet. We're not able to shop for natural or healthier foods. The stress levels are higher, which can influence sugar. And then I think a lot of patients are not able to go to or not willing to go to their pharmacies, and perhaps maybe missing their normal diabetic medications. But many, if not all, of the chronic diseases are exacerbated with COVID. Next slide. So our messages to patients with chronic conditions: take all medications as prescribed, inform your physicians immediately about any new symptoms. Please don't be afraid to go to the doctor or the pharmacy. They're taking all the appropriate precautions to protect you and themselves and their staff. Maintain a healthy diet and make sure that activity and exercise are made a priority. Next slide. And just lastly, we know that chronic disease prevalence remains high, and it's actually, unfortunately, increasing in the United States. We want to emphasize the importance of the Life Simple 7 in controlling these lifestyle and health factors to predict and prevent heart disease risk. We can do better, and few in the US have ideal levels or are all in the green for all 7 factors. not smoking, getting exercise, maintaining healthy diet and body weight. They really are the cornerstone of ideal health, and we should all be working to improve our efforts and encourage others to improve. And finally, we know that COVID is an important and additional risk for those with chronic conditions, and they have to be monitored even more closely until we're through with it. Thank you so much.
Thank you so much for that, Dr. Hedgepeth. There were so many really important points made during that presentation, and I know at the American Heart Association, we really want to emphasize to people that it is safe to go to the doctor, it's safe to go to the hospital as needed, and to your pharmacy. And for a lot of that medication management, you can always call your pharmacy first and make sure that your medication is ready for pickup so you can go in quickly and leave. We just want to make sure people are staying healthy during this really unprecedented time. And with that, I just want to remind everyone we had some good questions in the chat box. The chat will be open until the end of the presentations, and we will answer them after our next presenter. So at this point, I'm going to turn it over to Rosemary O'Brien, who is the Health and Wellness Specialist with Neighborhood Health Plan of Rhode Island. Welcome, Rosemary.
Hi, thank you so much. So I am a Health and Wellness Specialist at Neighborhood Health Plan, as Victoria stated. Today, I'd like to talk to you a little bit about preventive health. Actually, Dr. Hedgepeth talked a lot about things that you can do for preventive health. But preventive health is mainly taking care of your health before you get sick. So going to the doctors not only when you don't feel well, but once a year, having a physical, finding out, are there things that you're at risk for, certain chronic conditions? Even if you feel fine, it's really important to see your doctor or medical provider at least once a year to make sure that everything is okay. That visit may include getting blood work, having shots or immunizations, having certain screening tests. All those things will help you to determine if you are at risk for a chronic condition or if you currently have something medically going on that could be helped now before it gets worse. Next slide. Why don't people go to the doctors? There are a fair number of people who don't go to the doctors, and there are a variety of reasons. These are just some examples. One could be that they don't have health insurance, so they cannot afford to go and have a large medical bill. So there are a number of community health centers throughout Rhode Island, which people can go and get health care on what they call a sliding fee scale. So you'll be charged based on your income. Sometimes people don't go to the doctors because they don't trust doctors, or they don't trust, maybe it's a ethnicity thing. So sometimes I was just at a diversity conference and they talked about, you know, sometimes people just say, for example, in the Latino population want to see a Latino physician because there would be more trust. Unfortunately, we have a lack of Latino physicians in the state. And then other people might not go because they don't want to find out that something is wrong with them or that they have a medical problem. They're fearful of getting bad news. The problem is, even if you don't know that you have a medical condition, or say you are pre-diabetic, that you have pre-diabetes, there are things that you can do to help prevent that from getting to diabetes, but you wouldn't know that unless you go to the doctor and you have blood work, an examination. So even if you have a medical problem, if you don't know about it, it's still not going to go away. It's still going to be there. Next slide. Neighborhood has put together a member rewards program to help people get involved in their preventive health care. There are certain behaviors, healthy behaviors, that Neighborhood will provide gift cards when you complete these behaviors. So the whole idea is to get people involved in preventive health and reward them for doing so. And we have rewards for children, teens, and adults. So if you have neighborhood and you have Medicaid neighborhood, or you have Medicaid as a commercial plan, so you purchase neighborhood, you are eligible for these rewards. We started at the 18-month well visit for children. We did that because the 18-month well visit is really important to kids. They do, the doctor does developmental screenings to make sure that the child is developing at a normal rate. It's a great time to catch up on missed immunizations. So if someone takes their child for an 18-month well visit, they can get a $25 gift card to Walmart. All our gift cards are for Walmart. So if a child by their second birthday has all of their recommended shots or immunizations, by their second birthday, they can get a $25 gift card. And if they have at least one lead screening test by their second birthday, they can get a $25 gift card. From there, anyone from age 3 years old up to age 64 years old can get a $25 gift card if they go for their annual well exam, their annual checkup. We also, if someone has asthma and they do what's called an asthma action plan with their medical provider, that is a plan that's put together between the doctor and the patient that helps them figure out, how do I prevent an asthma attack? What am I going to do when I have an asthma attack? When is it time to call 911? So if someone completes an asthma action plan with their medical provider, they can get a $25 gift card. And if they have diabetes and they get a blood test called an A1C test, and they have a blood pressure check and a urine test, they can get a $25 gift card for Walmart. We also provide up to $50 gift card for a gym membership. So if someone is enrolled in either a gym or some kind of organization that promotes healthy behavior, so it could be a gym, it could be a kickboxing studio, a yoga studio. If someone is enrolled for 3 months consecutively, they can get a they can get up to $50 in a Walmart gift card. And then we also have prenatal rewards. It's so important for women who are pregnant to get early and comprehensive prenatal care, and then to follow up after delivery and have their postpartum checkup, which is the checkup that they have after delivery. So in order to encourage our members to do that, we put in place a member rewards program where if pregnant women have a certain number of recommended prenatal visits, they can get a $20 gift card, which is a Visa gift card. And if they go for their postpartum exam, their follow-up exam after delivery, within a certain period of time post-delivery, then they can get a $20 Visa gift card as well. These things have been put in place to help folks remain healthier, prevent heart disease, prevent diabetes, prevent high blood pressure. If you don't know that that's the direction you're going in, then you can't do things to prevent it. And that's where you get your education, is when you go to see your doctor or your provider. To find out more about these member rewards, you can go to Neighborhood's website, which is here on the slide. It's NHPRI.org. Then it's going to ask you to pick your insurance plan, whether you're Medicaid or commercial, and then you can click on rewards. And all the forms that you need will be there. There's a child form, a teen and adult form, and there is a gym membership form on there as well. And I think that's it. And I want to say thank you to the American Heart Association, and thank you to all the presenters today. And thank you all who are on the webinar for your time.
Thanks so much, Rosemary. That concludes the presentation portion of the webinar. So now we want to hear from you and turn it over to some of your questions. If you have questions right now, please write them in the chat box. I'll go and ask some that we had throughout the presentation. So I want to invite our presenters to come back on camera so we can ask some of these questions. The first, we have two here that I think might be good for Dr. Hedgepeth. they're both about numbers. So the first is from Yesenia. How high should the heart rate go up to when exercising? And how long is an acceptable time for your heart rate to go back to a normal rate? I assume that's after exercising. You're on mute, Dr. Hedgepeth.
So, great questions. Okay, so for max heart rate, if you take 225 minus your age, that is your maximum kind of acceptable heart rate. For exercising, kind of in what we call this kind of fat burning or moderate zone, you want to be at 60 to 80% of your max predicted heart rate and kind of stay in that zone. If you go above that zone, you're kind of in a high intensity workout, which is fine, but you'll not be able to exercise in that zone for very long. So for regular moderate exercise, we think that 60 to 80% of max predicted heart rate is appropriate. So then the next question was, how long should it take for the heart rate to come down? So the more fit you are, the quicker that your heart rate will recover back to baseline. So I usually think about within 1 minute after stopping exercise, your heart rate should have dropped about 20% from the peak. If it does that, then you're pretty fit. If it takes about 3 minutes to drop about 20%, then you're like moderate fitness. If it's longer than that, then we all have work to do.
Great. Yeah, and we just got another question about exercising, which I think is really good. So we had one question at the beginning about going back to the gym and if it's safe to go back to the gym given COVID-19. And then we just got a question from Joan about what exercises can be done at home for a 69-year-old woman who has limited space and chooses not to go outdoors because of concern with COVID.
Right. So I think the first question about going back to the gym, I think not all gyms are created equal. So you really want to, if you're interested in going back to the gym, you really want to check on their safety protocols, make sure that there's good distancing, make sure that they're requiring a mask and that there's somebody, either the user or their staff, to really wipe down all the equipment after each use. So we've seen patients and go back to the gym successfully and have kind of pretty minimal COVID risk. The second question about exercising at home with limited space, I think, there's many YouTube videos for kind of isometric exercises or using your own weight to kind of do like what's called a 7-minute workout, which is like squats and lunges and doing sit-ups and push-ups or a minimally kind of moderate to minimally intensive exercise in a limited space.
I'm on mute too. Thank you for that. We got a really good question about kids struggling at home. And I'm wondering, Mark, if you guys have any resources on this. So the question is, I can tell that my kids are struggling between hybrid classes, not seeing their friends, and all the changes with COVID-19. Are there resources for parents and kids on how to manage stress?
Yeah, so it's really hard right now. I think if we had an answer for that, we could solve a lot of problems. But everybody's dealing with a very unique situation, and everyone's situation at home with their kids is different. I think that one thing I can tell you is we have support groups at RIPIN, and you can find those at www.ripin.org. I'll also put my email in the chat, and you can email me if you are looking for any more specific resources. But we do a monthly support group of parents of kids with special needs in particular who are, some of them are distance learning, some of them are in a hybrid situation, but they definitely can help share different coping skills around that.
That's great, Mark. Yeah, I think with every student is dealing with different things, whether they're in school, whether they're in hybrid, and parents are working from home and some have to go in. It's a really hard time. And I know that it's not only kids, but parents that are managing stress in a very new way. So any resources that we have out there are really, really helpful. Yeah, go ahead.
It's Rosemary. Can I just add that if someone is a neighborhood health plan member, that we do, part of their benefits is behavioral health benefits, so they can contact neighborhood and access whether it's counseling or some kind of supportive services that would be covered by neighborhood. And I know a lot of behavioral health providers right now are doing that virtually. So, you know, if folks are afraid to go out due to COVID, then I know there's a big demand for behavioral health services now because there is so much stress and there is so much, you know, effect of being stuck in the house. But I just kind of wanted to put that out there.
That's really helpful. So just so everyone knows, neighborhood health plan, Rosemary, you're saying will help with behavioral health as well as gym membership and making sure people are active and healthy, correct?
Yes.
Perfect. We had another question. I'll direct this to Dr. Hedgepeth. How can I make sure that my blood pressure and cholesterol numbers are in a healthy zone? This is especially difficult if we're not going into the doctors regularly. So do you have any tips and tricks for that?
So, you know, I had mentioned that, you know, for the blood pressure, you know, if it makes sense from a financial standpoint to invest in a blood pressure cuff, you can order that from Amazon, and if you don't want to go to the pharmacy, and then kind of self-monitor the blood pressure at home. We think about optimal blood pressure being like in the 120s, the top number or systolic number, 120s to 130s, over 60s to 80s. If you're seeing blood pressures above 140 over 90, that would be concerning. The cholesterol is a little bit tougher because that's a blood draw. You know, so that would have to be arranged through primary care or like a minute clinic. But still very important to check that, you know, at least once a year for those who are 40 and over.
Great, yeah. And the American Heart Association has a wonderful website called Target BP, Target Blood Pressure. And there's a whole section on there, both for clinicians as well as for patients or consumers who are at home, on how to take their blood pressure. And there's diagrams, there's videos, there's a lot of information there. So if you do decide to go to CVS or Amazon and get one of these cuffs, you can learn how to take your blood pressure at home really easily and monitor your numbers, which we know is super important. So with that, I don't see any more questions. Do any of the panelists have final comments that they want to make? This is your last moment.
Just a great opportunity to talk about heart disease, and you know, I'm passionate about it and all the ways that we can prevent it. Put me out of business.
Great, thank you. Well, I'm so grateful to all of our speakers this morning. I think you all brought such really amazing information from different scopes of work and organizations. We're so grateful to have you, especially in our community. And I'm thankful to everyone who was able to attend the webinar. As I mentioned at the beginning, we will have a recording that we will post on our YouTube page in a couple of days, so you're welcome to share that out. I also want to let everyone know that we are going to be doing a second community conversation through RIPIN, and that one is going to be on October 29th at the same time from 3 to 4. And that's going to be a really in-depth conversation on smoking and vaping and how both of those activities can impact COVID-19, how we're seeing a rise in youth vaping and what that means for the health of our youth, and just overall health when we are talking about smoking and vaping, especially with people staying at home and maybe not taking care of their health in the same way. So I hope you'll be able to join us for that. And with that, thank you all so much for attending today, and we hope to see you on the 29th. Thank you.
Thanks, Victoria. Bye, everyone.